Hi guys, hi. Okay, let's wait a couple of minutes. I'm trying to see if I get some people to come. This is something I really want to talk about, really makes me angry, it really upsets me. And I want to share this with all the women and black women suffering from PCOS, suffering from excess weight, and suffering from unwanted hair. So I'm just waiting. I'm on few platforms to see who is going to join us, and I will start talking about it. Okay, well, let's see. Just what's the time? Okay, we should have some people coming on. Hi, Andrew. Hi, guys. Hi. Okay, I'm going to start. Hi, YouTube. Hi, Krappa. Hi, guys. So here is something that I want to share, and I'm calling on all women that suffer from PCOS, endometriosis, that are overweight, that suffer with weight problems, not only with unwanted hair, not only with this, but with weight problems. I am calling on every single woman. Hi, YouTube. I'm calling on you guys. Listen to what I have to say. I got up this morning. I'm so angry. I'm so furious that I have to take my frustration out and share this information with everybody because it makes me so very angry. And I'm calling on all the black women that are overweight, all the black women that suffer from PCOS, which is about 70% of black women do suffer from PCOS. So I want you guys to listen to what I have to say. First of all, the first thing that I want everybody know, and I want every black woman, every white woman that suffers with PCOS, endometriosis, hormonal imbalance, Hashimoto disease, I want you to understand something. Your weight is not your problem. Your weight is not something that you are responsible for. Your weight is not something that you caused. Your weight is caused by the disease. Your weight is caused by hormonal imbalance. Do you people understand? Do you people understand that when you have hormonal imbalance, that our hormones in our body are responsible for every action that happens in our body. Every action that happens in our body is responsible due to the hormones. Do you understand that hormones regulate everything? Hormones regulate your brain. Hormones regulate everything in your body. Do you understand this? So why on earth is it? And I have to say that for majority of physicians, they are absolutely idiots, and male physicians, even bigger idiots, when they tell women, and particularly in rural areas of America, when they tell women that have PCOS, okay, lose weight, you will be better off. Oh, you are too fat, you have to lose weight, your PCOS will be better. Or there are influencers, or there are people that are even more stupid and that are even more harmful because they do it for money and for fame, and they post all these stupid statements on social media stating, oh, I did this, you have to do, you lose weight, now I lost my PCOS. No, ladies and gentlemen, let me explain you something. When you have polycystic ovarian syndrome, what does it really mean in real life? Polycystic ovarian syndrome means that you have cysts on your, or that you have cysts on your ovaries, you have cysts around your uterus, you have cysts, sometimes cysts on the abdominal cavity. You have a hormonal imbalance. These cysts happen because of a hormonal imbalance. We do not know 100% today why this is happening. They know what causes it. They know that in the past, they used to suggest that women should do hysterectomies. And if they do hysterectomies, even if they are 28 years old, then they will not have polycystic ovarian syndrome. And I can tell you this, that many people, many women, in particular black women, and in particular in the deep south and in the countryside, were recommended were recommended to hierarchy, were recommended to do hysterectomies at very young age for two simple reasons, and this is my personal opinion, okay? And I have a lot of reasons to have opinions and be opinionated about this subject. Just listen to me very carefully. The number one, it's easy. It makes money. So who gives a shit? Who cares? It's a black woman. Who cares? So let's have a hysterectomy because then we'll solve the problem. She will have a hysterectomy. Never mind that she cannot have children. Never mind that she goes into early menopause. So that was the first thing. And I have hundreds and hundreds of women. I am 40 years in my business. Hundreds and hundreds of women that had hysterectomies that were not necessary to do. That's number one. Number two, I want to tell you something. That hysterectomies did not solve the problem, of PCOS or endometriosis, even stage number 2. Now, why am I so passionate, and why am I talking about it, and why am I talking with authority? Just listen to me very carefully, guys. I have one child, one daughter. My daughter suffered for 30 years from starting, she was at age 14, she got PCOS. That was the first thing. They identified her. First it was PCOS, then she was maybe not even 15 when they identified her with endometriosis. Ladies and gentlemen, anybody, any woman that understands what PCOS and endometriosis is, understands that it's a curse. It's a horrible condition. But here's something that I am going to share with you. I'm going to share with you not because I want to share my private life, not because I want to put it out there, but I am sharing with you because I want this knowledge. I want people to understand. I want women to stop beating themselves up because they are overweight, because they cannot lose weight. If they have a hormonal imbalance, you are beating your head against the wall. And it will be super difficult to lose weight, even with Ozempic. Even now, how do I know all this? So I will share with you, and you will listen to me, and you will understand why I have so much passion, right? So I'm speaking to you as a mother, I'm speaking to you as a professional, and I'm speaking to you as a human being. So I treat human beings over 40 years in America, anything to do with the skin and unwanted hairs and discoloration. That's what I do. I am the number one black skincare expert in the United States. I came to America with the experience and the knowledge of treating skin in Africa. Black skin in Africa. I am the number one authority when it comes to black skin. But now, listen to me carefully. So my daughter, and we are now going back 30 years, okay, 30 years. I treat in my Miami Beach and in my Atlanta Nuna location, I treat tremendous amount of black women. And people come to see me from all over. People fly to see me from all over America because of my expertise, my passion, and my caring as a human being, and my understanding what is happening to women. So here is something that nobody will teach you, nobody will tell you, and this is actually factual because I'm taking it from my own life, and I am the authority to talk about it and to dispel all the myths. So myth number one, if you're a black woman, if you're a white woman, if you're a Hispanic woman, and you have PCOS, you're overweight. Your problem is not only irregular periods, your problem is not only heavy clotty period, your problem is not only having a lot of pain, your problem is not only being hairy, your problem is okay, I see Japanese, your problem is also that you are having excessive production of androgen and testosterone, and you have excessive hair growth, you have excessive bleeding at times. Sometimes your periods can last for a week, for 10 days. Sometimes you can have heavy clots. Sometimes it's so very painful. And sometimes you have a ruptured cyst. a ruptured cyst. I only wish it on my enemies because ruptured cysts are at least as painful as passing a kidney stone. If you have a big kidney stone, I had both. And I can tell you that both, you talk to God and ask Him to take it because the pain is excruciating when it happens, okay? So this is what happens. This is what happens. And when you have all these problems, in addition to these problems, because you have a hormonal imbalance, you're also gaining weight. And people are blaming other people, and people and own families are blaming their daughters and stating horrible statements about their daughters. When their daughters suddenly gain weight, they get a full beard, and nobody understands that this is really an issue, and it's not just because she's eating a bad diet and she's eating and she's gaining weight from it. She's gaining weight because she has a hormonal imbalance, and the hormones in many ways are blocking you to the ability to lose weight. But here is something that I would say that majority of family practitioners, I think, and OBGYN gynecologists, I still think its majority is men, not women. I want to ask you, how much a man that has a penis and testicles, doesn't have ovaries, doesn't have a uterus, doesn't have PCOS, doesn't have a period cramps, how much does he know? All he knows is what he learned in school in books. It's number one. Number two, if he doesn't really have the knowledge and experience of 30, 40 years, then in my personal opinion and in my personal knowledge, he knows very little about the subject. A man cannot understand a woman because a man is a man. The same way I cannot understand a man's condition because I'm a woman and I don't have the same organs as a man. Men cannot understand. I can tell you this, I've seen this several times. Women created simulators that they can put some pads, it's an electronic system, and they are simulating period cramps. There's only period cramps. And I've seen tough guys, so oh my God, screaming, okay? So the bottom line is this. When doctors tell you that you should lose weight, tell him to go and screw himself. Because this is not up to you. He should go back to school, he should go to the internet, he should do research, he should study, and he should find out that PCOS and endometriosis, and hormonal imbalances, one of the main signs, a part of all the signs that you have, is gaining weight. A woman cannot lose weight. It is 100 times harder to lose weight for a woman when she suffers from PCOS and endometriosis than it is for a woman that doesn't have hormonal imbalances. So when they tell you, and I see it on Instagram, I see it on social media, and it makes me so angry, and I saw it last night again, some stupid influencer that came up and said, and here the doctors also validate this, you lose weight and your PCOS will go away and mine went away. And that's full of shit. In English, shit, that's exactly what I mean. It is not true. It is not possible. And I'm going to dissect this now. Piece by piece by piece, so you guys understand why this is not possible. And stop beating yourself up as women that you cannot lose weight, that whatever you are doing, it's not working. So just listen to this. This, for my daughter, started over 30 years, okay? I live in Miami Beach. I treat, in my clinics, I treat a lot of physicians, a lot of surgeons, men and women. I have physicians that work with me. So it is not a question of me not having the ability. I am more fortunate than most because I have the ability and I have direct access to physicians or to my clients to talk about this condition for my daughter. And the first, I told you at 14, she was identified with PCOS. The cramps became so bad, so horrible. so excessive that she had her first, she was less than 15, she had her first, hi Mona, she had her first laparoscopic surgery at Mount Sinai in Miami Beach to do away with the endometriosis. Here's something that I want everybody to know. Endometriosis is the next stage after PCOS. Endometriosis is a condition where the lining, it's a defect, it's a genetic defect. The lining of your womb, okay, the lining of your womb. So we have a womb, and the womb where the baby is carried, the womb has a lining, a lining. That lining was, there's a defect, and instead the lining standing inside the womb, the cells of the lining come out. The cells come out, and when the cells come out, now just follow me. When the cells come out, you know what Play-Doh is? Play-Doh. It creates it's something like a line, like a Play-Doh, like a line. And it can, let's just say, I have, this is my uterus, this is my ovary, and this is my ovary on the other side. Or this is my ovary, and then this is my appendix next to it. So the lining here in the middle is my uterus. The lining makes a line, comes out. It creates like a Play-Doh line. It wraps around the ovary. Just listen to this. It wraps around the ovary. Then from here, from the ovary, it jumps to my appendix. And now it wraps around my appendix. Now what happens when you get your period? Your ovary expands, right? Because there's blood in the ovary. Well, when that expands, do you understand how much pain that causes when it expands? Because it's being choked up, like with a rope, it's choked up. So the blood that is in the ovary, it creates tremendous amount of pain, tremendous amount of pain. Now, you have this line from the uterus wrapping around your ovary. Then it can go from your ovary, it's pulling now into your appendix, into your tube, into your colon, into your spine. It just can go anywhere. It just goes anywhere. And it pulls, and it pulls. And the pain is excruciating. Ladies and gentlemen, I, for 30 years, every single month, injected my daughter with morphine because the pain during her period was excruciating. My daughter has had 18 surgeries. She lost over 70% of her reproductive organ, eventually 100%, and other organs. And I want you to listen to me. She was 100 pounds overweight or more. We struggled, but because I understand anatomy, because I understand biology, because I understand hormones, because this is what I work with, I understood the plight, the pain, the suffering of everything. On top of that, she gained weight. She had excruciating pain. She became hairy from her forehead to her toes. She was fortunate to be my child because I was able to take care of her hair and do laser hair removal on her. And she was very fortunate because I am her mother and she is the white of my eyes and she's my life. And I would do anything and lay my life down for her if necessary to find a solution. And because I am an intelligent, I am educated, I am a hovering over mother, I care, I did what I had to do, and I researched. So she had 4 surgeries in Miami, but there was nobody who specialized in endometriosis. And if I can describe to you endometriosis, so the cells look like little pinheads. And these pinheads come in different colors. They can be reddish, they can be orangey, they can be whitish, they come in different colors. Now, if you picture yourself as a woman, if you just picture your abdominal cavity, okay, how difficult is it to find a tiny little pinhead? And there are hundreds of them, and they can be spread anywhere. So I eventually found a surgeon in Atlanta, in Georgia. I think he is a godsend. He was a godsend to me, not because he could change the outcome of my daughter's life, but he was a godsend because he gave us reprieve and he understood what he was doing. He operated on my daughter 14 times. I had to fly to Atlanta 14 times, sometimes twice a year, because the only way to get rid of the pain, to get rid of endometriosis, which is the next stage from PCOS, is excising, cutting out. So what does that mean? That means that you have to go through the vagina and then you have to go through the belly. You go in. And what they actually do is physically, they put air, they blow your belly up like a balloon. They flip you around. So your organs should hang. So you're on the operating table, but they flip you around. There's a camera inserted in there. And the camera moves around, and on a big screen, he looks. And then he has clippers from another side that go in. And he cuts out part of the organs that are wrapped around with the endometrium lining, and it creates like a play-doh. So he cuts that out. He cuts and then they take it out. It comes out through the vagina. They take it with clippers out. It comes out. But they also burn. They burn, and they look. And when they see these endometriosis, these little pinhead dots, they burn them. They get them out. But ladies and gentlemen, it only requires one pinhead of a cell to stay. And doctors are not God. Even God couldn't do this. Even God couldn't find this. And so what happens is one cell stays, and 5 months later, this one cell multiplied. So now follow me carefully and please pay attention. This is, you will understand why I speak as an authority on this subject. This multiplies. So I can give you exact lined out how this process works. So I would go, they would excise, let's say they cut 1/3 of a uterus out, and they didn't cut the uterus out because she was young, and they thought, well, maybe, if they leave a little uterus, maybe she will be able, artificial insemination, she will be able to carry a baby in vitro, whatever. So they cut part of the uterus out. They removed a ovary. They removed a tube. They had to fix her lower spine because it attached itself to the spine, so they had to separate it. And so in one occasion, he operated on her and he said, okay, Eva, everything is clean now. Everything is fine. After several days staying in Atlanta in the hospital, I would fly back to Miami. 5 months later, she was climbing the wall. 5 months later, she was climbing the wall. The pain was excruciating. And I can see it. And any mother that has a daughter, or any woman that has PCOS or endometriosis, guys, your eyes, when you are in so much pain, your eyes become like glass, like you look through the eyes and it gets completely dark under your eyes. And my daughter is biracial. You can see the darkness on the eyes. You can see that it is much darker on the, I could see. And so the pain, and she said, and she would sit on the toilet for hours and she couldn't move. And she said, I can't move, Mom. I can't move, Mom. So I called. He said, get on the plane, fly with her. I flew, I brought her to Atlanta. He looked at her, they did a vaginal ultrasound. He said, Eva, we have to go in immediately. What happened was, in 5 months, that one cell, wherever that one cell was, multiplied, and now it wrapped itself around her appendix. And the appendix was about to rupture because it's like a rope, you wrapped around the appendix. So they had to go and remove the appendix. And this went on. We did this for over 20 years. This went on and on and on and on and on. Then we had a surgery. I came out, it was like 5 a.m. in the morning. My daughter is sitting, we live together. At the time, she was sitting on the toilet at 5 a.m., rolled over. And I said, what's happening? But I could see on her face she was gray. She said, I'm in so much pain, I can't move. I called the ambulance and I rushed her to the hospital next to my house. Well, it wrapped itself around the gallbladder. They had emergency surgery within half an hour being in the hospital. They had to remove the gallbladder. Guys, when I tell you that this is a super ugly disease and there is no solution for endometriosis, there is no solution for this disease, and it is the next stage after PCOS. And when anybody can come to you or well, to me they can't, because I bitch them out immediately and tell them that they're stupid idiots and they should go and dig holes somewhere. When they can come to you and tell you that it is your fault and you should lose weight and you will be better off, they are morons. They are stupid. They don't know anything. They don't know anything. And why I speak so powerfully to women now, why I'm speaking to, because again, I read something last night and I was so angry. I said, okay, I have to speak about this. So just listen to me very carefully. So she had 18 surgeries altogether, right, from age 14 starting. Eventually, all her reproductive organs were out. Her womb, her uterus was cut 4 times until they removed, 5 years ago, it was final. They removed the final part. Of course, she couldn't have children. Now, some of you might laugh and poo-poo this out, but when you go inside and you cut every burn in a woman's body leaves scars. Anything leaves scar tissue. Try to have sex when you have 10 million scar tissues in your vaginal canal. If you have scar tissues anywhere, everything hurts. Everything hurts. So sex is not the dominant thing that she is interested in because it hurts. It hurts to have sex. It's not a pleasurable experience. It is painful. At some point, just listen, at some point when all organs were gone, so all our reproductive organs were gone, all the other organs that were affected were taken out, she still complained about pain. So then there was a solution. Just listen to this, okay? So you understand what I am saying, and so you understand why I am so angry and why I must speak to all women and to black women and let them know, don't let anybody ever tell you that you are fat, that you are overweight, that you have to lose weight, and then everything will be okay. So her doctor, her surgeon in Georgia, in Atlanta, said, listen, the pain is excruciating again, but there's nothing, your cavity is empty, there's nothing there. So the only thing that they can do, it's a medical term, it's called neurectomy. And neurectomy is when they cut, they go across and they cut all the nerves. So when the nerves are cut here, you know you have pain, but you don't feel it, because pain, you feel this, but there are messages that go to the brain, and then you know you have pain. So what they did, and this is a very complicated surgery, because cutting the nerves across the belly, cutting the nerves is a very delicate, it's like a watchmaker, very delicate surgery. Why? Because if you cut one wrong nerve, let's say that goes to your bladder, to your urine bladder, if it goes there and you by chance cut that nerve, you become incontinent. So you're a young woman now, not only you have this problem, but you also become incontinent. But because 30 years of suffering of pain, it is something that you will look for any solution, for anything to help you to eliminate the pain, because you are sick and tired of living in pain. 30 years you live in pain, you are sick and tired. You live in pain, you are hairy, you are overweight, you are miserable, you are sick and tired. So I thought about it, I did some research, I spoke to some friends of mine in the industry, and they said, Eva, go ahead. Let them operate on her and let them do the neurectomy. So they cut, they can only cut in the middle. So they cut the middle, not the sides, not where usually your ovaries are, but just the middle. So they cut the nerves across, they did a neurectomy. So she knew she had pain, because up to this point, from pubis up, there is pain, but you don't feel it in your head. You feel something, but you don't feel pain because the nerves to your brain are cut off. So you don't feel the pain. You understand how complex this situation was, how painful it was for her, and how painful it was for me as my only child, as a mother to an only child, to go through all this. To go through all this. Today, my daughter is 49. Of course, she could never have children. She is pain-free as far as no period, as far organs. But because she had 18 surgeries, she has scar tissue. And I don't know if you understand that, but maybe some people can understand. There is some relationship between your mental stage. There is some relationship between barometric pressure, between changes of weather, that you feel pain in areas that you normally don't feel pain. So she feels pain. And we have these conversations because I was trying to do a skin treatment for her, but that treatment is painful. And I said, okay, I will put some numbing on you. And she said, Mom, do you understand? I am tired of pain. I don't want anything that causes me pain. I suffered for 30 years. I had so much pain. I don't want pain. So, and it hits you hard as a mother because it just reminds you how much pain your child was in her whole life. So, now I come to the weight thing. Remember that I said that my daughter was at least 100 pounds overweight? Today, there is nothing there. She doesn't have a period. She's in menopause. She's now on bioidentical hormone replacement therapy because she's young. So she needs to supplement this with something else. Today, her situation is such that her life is kind of like this. Kind of like this. I don't see the happiness in her, and like you would see in other people, because it took a toll on her life. Yes, she has no hair because I took her hair. I did laser hair removal on her, and this is something that I want to share with every woman and every black woman, and every mother and every grandmother and every sister of a woman that suffers from PCOS, a woman that suffers from endometriosis, a woman that suffers from Hashimoto disease. This is all related to hormones. Everything. Your thyroid is a hormone related to your hormones. Everything is related to your hormones. Okay? I want you to understand something. For a minute, I think I lost my thought because there are so many thoughts going in my head, and so many things comes through my head as I'm talking to you. And for instance, something just popped in my mind that that disease even affected her kidneys because they are in the back. They are sort of kind of in the back. You have hormones and that are released from on top of the kidneys. It releases, and because there was a problem, they had to operate on her, and they had to create stents on top of her kidneys. So ladies, when I tell you that this disease, PCOS, endometriosis, is a horrible disease. Now, true, not every woman will suffer like my daughter. My daughter had stage 4 endometriosis, goes from 1 to 4. But she had PCOS, then it graduated to endometriosis, then it went to stage 4 endometriosis, then she was diagnosed with Hashimoto, the thyroid condition, all related to the same thing, to reproductive organs. So we solved the problem with hair. We solved the problem with pain to an extent. but we didn't solve the problem with weight. Remember, I said she was 100 pounds and more overweight. And of course, she wouldn't let me see, but I could see her body. I know what would happen. And you know that when you are overweight and you can't lose weight and you're in pain, it's sort of misery likes company. It's a very bad stage to be in. And we gravitate to food when we feel unhappy, when we are in pain, when we are in distress. So yeah, she would eat. Like she wouldn't eat the whole day, and then she would sit down and she would eat. And she loves bread, and she loves potatoes, and she loves stuff that is fattening. And she would eat, and she would eat incorrectly, and she would eat once a day, which aided her in addition to gaining weight. And now that she is 40, she's 49 actually this month. She will be 49. Uh, she decided that she wants to do something about her weight. Now that there's no more hormones, no more period, we do something about will endometriosis attach? It can attach to anywhere. Bladder. I will stay with me, guys, because all these questions come, and I will share this with you. I'll tell you what happened to a bladder. So yes, it can attach. But let me just tell you something about weight, because this is what I started with. Today, my daughter is on Ozempic. Ozempic. Anybody else on Ozempic loses weight. If you lose 8 pounds a month on Ozempic, my daughter loses half a pound per month, because her hormones that are functioning in her body are working against her. It's working against her. So any woman that has PCOS or had, and now they don't have, or they have, or they had hysterectomies and they think that now they don't have, they still have a hormonal issue, and you are on Ozempic, you can't lose weight. You can't lose weight like every other woman that doesn't have a hormonal imbalance that can lose weight. So it will take a woman that has PCOS or endometriosis, it will take her maybe 3 years to get to the point of a woman that would do this in 5 or 6 months. Do you understand that? Do you understand that now why this is a hormonal issue? Do you understand that now why when people come and doctors and idiots and influencers come and tell you lose weight, that this is not as simple, that this is not something that can be done, that this is not a woman's fault, that this is not a woman's fault that is affected with a hormonal imbalance, that is affected with PCOS and endometriosis, that there is something in her body working against her. And take my word, remember what I'm telling you now. Just remember what I'm saying now, generally about obesity, okay? About obesity, which has nothing to do with endometriosis or PCOS. They will find out. They will find out. And then everybody will say, now I understand. They will find out that there must be some kind of genetic defect in the body, some kind of genes that don't work properly with each other that cause you to become overweight and obese. But doctors will beat you to death about your weight, but they will not consider the circumstances. And guy doctors, male doctors, know shit from Shinola. They don't know a woman's body. They don't know what woman goes through. So I will come, I want you to listen, because now somebody asked me on Clapper about the bladder. Just listen to this, okay? Does it affect the bladder? You bet it does. The urinary tract. So here is another thing that my daughter had to go through, all related to PCOS and endometriosis. And you will understand why I'm so angry and why I have so much passion, why I talk about it, and why I'm probably the number one person to talk about the subject in America. Because my daughter went through so much. So she would have constantly a urinary tract infection. You know, when you pee, it will burn constantly. Well, this is directly related to her condition. And we went to see a urologist. And I will tell you this, looking backwards on this, I I didn't know at the time, I didn't know at the time that this should not be done the way it was done. And I didn't know what I know today. And I'm telling you that a lot of stuff in medical offices are done, and the calculation is not what's best you as a patient. The calculation is what's best money wise and how fast you can do the procedure. So because she had constant urinary tract infection, and they were just constantly, you can't constantly take medications and you can't get rid of it. So they decided to do an ablation of her bladder. If anybody knows what an ablation of bladder is, you know what I'm talking about. And if this was done to you 25 years ago, you know what I'm talking about. I think that it is criminal. I think that doctors should be I don't know if sued, but they should be reprimanded and maybe re-educated, or maybe they shouldn't be allowed to do this. But here is what they did. So they said, okay, in order for her bladder, in order for her to stop having constant urinary tract infections, the bladder also inside is completely inflamed. So the lining of your bladder is in a permanent stage of inflammation. And when you have inflammation in your bladder, the lining of the bladder, the lining of the bladder becomes very, very thin. And it hurts. You're in constant pain. Do you understand what I'm talking about? How much pain this woman was in since she's 14? How much PCOS endometriosis affected everything else? And so they decided that they are doing an ablation of the bladder, the urinary tract bladder, and they did a treatment that they do for horses with DMSO, because they believe that DMSO that they injected inside the bladder will create and coat the lining and regrow the bladder. Ladies and gentlemen, I would go with my daughter in. They would give her something to bite, instead giving her on anesthesia, doing it under anesthesia, but they saved money. And I didn't know this at the time. Her legs were up. He would go with a scalpel inside her bladder. No, nothing. He would say, just bite down. And he would scrape her bladder that was infected, that was sent out, that was inflamed. The tears were coming down her eyes, and then they would inject DMSO fluid. The DMSO fluid on a human being has an effect that within 15 minutes, your body emits an odor like if you had eaten 100 pounds of garlic. This is how it smells, how it comes out of your body. And for 6 hours after the DMSO was injected into her bladder, she couldn't urinate. She was not allowed to urinate. Just listen to this. I would take her home. I would carry her partially to her bed, lift her legs. She would suffer from pain and from the pressure, because now there's fluid inside the bladder and she's not allowed to release it. And this repeated itself 6 times. Did it help? Yes, it did. But was this supposed to be done without anesthesia? No. Is this inhumane? Yes. Do you know what this is equivalent to? Having an abortion without anesthesia. It's the equivalent, because you are scraping the uterus out. This is what you were doing. He was scraping her bladder, just make it 10 times worse, because the bladder already was so inflamed and infected, and the lining was so thinned out. So should this have been done without anesthesia? No. But it was. So these are all problems that you get from PCOS and endometriosis. And again, I will repeat, if anybody can come and take and claim to any woman that has PCOS or endometriosis that is overweight, that she should lose weight and tell him, go screw yourself. You know nothing about the woman's body. You know nothing about the woman's suffering. You know nothing about the woman's anatomy. And it makes me absolutely furious. And it makes me angry. And it comes to my mind. It comes to my mind, ladies and gentlemen, that sometimes I would think, or maybe because it's men and guys as gynecologists, what do they know? They went to school, they studied, they have penises, they have testicles. Urologists, the same thing. What do they know? I always had this wishful feeling after I realized what he did to my daughter, that I would have just once wanted to take a tube with a scalpel and put it inside his penis and then scrape inside his penis. I would have loved to do that. Because what he did as a urologist to my daughter without anesthesia, and he could have done anesthesia, but it didn't happen. So when I come to you and I tell you, please do not, for God's sake, beat yourself out, and don't let anybody beat you out and say, oh, you have to lose weight. I lost weight, my PCOS went away. It's bullshit. It's not true. It's incorrect. You cannot lose weight, no matter what you do. Your body is working against you. Your hormones, your imbalance of hormones is working against you. Medicine doesn't know yet why, medicine doesn't know yet how, but we know the factor that it is working against you, because every single woman that has PCOS and endometriosis cannot lose weight and is overweight. Why? Why? Now, I tell you something else that I will think about. I say, okay, is there a situation, oh, maybe if I took her to a female gynecologist, would it be different? Not necessarily. Not necessarily. You have to understand that a medical field, so a physician goes to school for 6 years and then internship or whatever. So let's say he graduates about 8 years, 9 years, they have to make money because they have to pay the $500,000, $1 million in debt that they have, school loans. So they have to pay money. So you, I, and everybody else becomes a number, and it's a dollar. It will become a dollar sign. And I can recall precisely who it was at Mount Sinai Hospital 30 years ago, 28 years ago. I sent her, somebody said there's a female gynecologist. Sherman was her name. And my daughter arrived, and remember I said my daughter was very hairy? And then my daughter laid on the table because she had urinary tract infection, she was in pain, and so she wanted to examine her, and my daughter lay there, and then she came, she said, oh my God, you're so hairy like a monkey. She was a OBGYN, she was a physician, she was a doctor, she was a woman. She was a fucking moron, pardon my French, as a woman. So is there a difference between woman and man? I'm not so sure. A woman just understands because a woman will have period. But does a woman, is a woman doctor guarantee that you will be cared for better? No. No. Again, personal experience, black and white. When my daughter ran out of that office, I was sitting in somebody's house, and she called, she was crying bitterly. She was a young girl. She was not even 16. She called me, she said, I'm a hairy monkey. Do you know what that does to self-esteem to a child, to a teenager? And that came from a physician's mouth. I wanted to go and kill her. Kill her. However, obviously that didn't happen. I was talked down of it, and I just sent a message to her. Of course, my daughter never went to see her, and I made sure that any client of mine and any patient of mine never went to see her. And I made very clear, in those days there was no internet like today, but I spread the word around That is how she treats patients. That's how she treats young people and young children that come to see her. So, ladies and gentlemen, this is a disease. This is a disease that I believe it's a the genetic defect. We will find out one day, maybe in 5 years, maybe in 8 years, they will come out and they will find out that all these hormones that are linked and then they disrupt something else. And this is why you cannot lose weight. Why you cannot lose weight. And they will also find out why obesity, why people are obese. Yes, food has a lot to do with it, but a part of food, my daughter eats small quantities of food, not big quantities, but for her it's enough to look at food to gain weight. So I know that there is an imbalance of hormones. She's on thyroid medication, she's on pain medication, she's on hormone replacement therapy because she went in early menopause, right? So we have to give her something to balance it. So I share this personal story with you guys for one simple reason, that I don't want any woman out there to beat herself up. And I want every woman to listen to my story. And then you will understand that there is no reason for you to beat yourself up, that if I could not help my only child, and if my child cannot lose weight, because this is not up to me, this has something to do with her body, and that even with Ozempic, my child cannot lose weight. And it is so much harder that you have no reason to beat yourself up. And if anybody comes to you and tells you, oh, go on a diet, you will feel better and you will lose weight and endometriosis or PCOS will go away, they're full of shit. They don't know what they're talking about. Now, eating healthy, sure, you should eat healthy. But I believe that women that suffer from PCOS and endometriosis and hormonal imbalance and Hashimoto disease, that even drinking water, somehow the body would be able to convert this water into fat. Something will happen in the body. Something will happen in the body because there is this imbalance of hormones. And now I want to touch on the subject of hair, okay? And this is very important. Every woman should know, every black woman should know, every white woman should know. If you're a woman and you are suffering from hormonal imbalance, you're suffering from PCOS, you're suffering from endometriosis, you're suffering from thyroid condition, you're suffering from diabetes, I need you to understand something. You have, because of this hormone imbalance, what does it really mean? What does it translate to? It translates to elevated androgen and elevated testosterone. When you have elevated testosterone, I will show you something, so you understand what I'm talking about, okay? So you see this hair here, right? This is the skin. This is the hair out. And then I will come closer, if you can see, there is a blood vessel, it's like blue and red. This is the bottom, this is the follicle of your hair. Here, look, I'll do it here. So this is the follicle, and you see there are two blood vessels, blue and red. Okay, here, blue and red, blood vessels, they go to the hair follicle here, right? So these blood vessels, blood, the blood carries, and it carries also something very important to know. When it carries hormones in the blood, these hormones, they come to the hair follicle through the blood vessels, stimulate the hair follicle, and the hair follicle wakes up, and the hair follicle now germinates like a plant. So the hair follicle can be dormant, but there's excess hormones, and it stimulates. And so, just so you understand, on a square inch of skin on our body, we have about 1,000 hair follicles. 1,000 hair follicles on a square inch of skin. I don't have a hormonal imbalance. I don't have any problems. I don't have hair. I have just regular, like little bit of hair, on my legs, on my underarms, like little bit of hair. And now, I am 20 years past my menopause, so I maybe get 3 hairs, 2 hairs on my upper lip. I do laser and it's done. I kill my hairs. It's not a one-time treatment, but it's done. So I don't have a hormonal imbalance. I don't have elevated testosterone that would stimulate my hair growth. But when you have 1,000 hair follicles on a square inch of skin, when you have hormonal imbalance, when you have PCOS, when you have endometriosis, Hashimoto, thyroid, any condition that you have that's related to hormones, it brings hormones, blood, and oxygen to the hair follicles, and it stimulates hair follicles. So a woman that has PCOS or any other condition might have on a square inch of skin 3 to 4 to 500 hair follicles that are active. This is why black women and white women that suffer from PCOS and endometriosis have a full beard, because their hormones are stimulating their hair follicles, and they're constantly growing hair follicles. And this is something that's important for everybody to know, that even when you you take medications, you're identified with PCOS, with endometriosis, there are medications, there are birth control, there are several other medications that are prescribed to balance your hormones, right? To balance your hormones. But what in reality happens, those hair follicles that were already germinated and active, even if you take medication, those hair follicles that were active will not stop. They will continue growing hair. So if you have 300, 400, 500, 600, 200 hair follicles that are active on a square inch of skin, they will continue growing even when you do hormonal treatments, when you see a doctor and they identify you and you have a good doctor and they say, okay, you take this and this and this. What the medicine will do and the treatment will do, it will stop additional hair follicles that have not been activated to become activated. It will stop that. It will stop germinating those follicles that are not activated. But those follicles that once germinated, produced one follicle, one hair, those follicles will continue growing. What is it that you need to do when these follicles continue growing? What is it that you need to do? The only solution you have is laser hair removal. Laser hair removal is the only solution. Now, this is where I come into the picture. If you can make it to Florida, to Miami, you can make it to the Atlanta Noonan location. And particularly if you are dark or black. Because as the #1 black skincare expert over 40 years in the United States, I know how to treat black skin. And there is a special laser that is only specifically made for black skin, for laser hair removal. That's the only, if it's the Nd:YAG laser, that's the only laser that's approved by the FDA to treat black skin. What is the difference between the laser for white skin and for black skin? That this Nd:YAG laser will not burn you. Of course, it will not burn you if the operator, the doctor, the practitioner that uses the laser knows what they are doing. They can burn you. I can burn you even standing in the sun. I can burn you. You have to know what you're doing. But the only laser that will not burn black skin is the Nd:YAG laser. And I treat people so in Miami for 40 years and so in Atlanta Noonan with the Nd:YAG laser to get rid of the hair. But what is important to understand is this. If you are like me, and you say, okay, I want to do my legs, or I have underarm or bikini, whatever it is. So I will tell you that you require a series of 12 treatments. 12. That you require 12 treatments. Hi from Belgium. Hi. I'm sorry I did not see you because I'm on 2 platforms. However, if you have hormonal imbalance and you come to see me and you have Hashimoto disease, you have PCOS or endometriosis or both or diabetes, I will tell you that you will require 30, 40 treatments. But because I have so much empathy and I care so much for women, because I, on my own skin, went through this for over 30 years with my daughter, I do not charge you $1 more after 12 treatments. I will treat every woman that has hormonal imbalance, that has PCOS or endometriosis or Hashimoto disease and has unwanted hair. You will only pay for 12 treatments like any other woman. And any other treatment that you need, I am doing for you for free. That's my commitment to women. That's my commitment to women that suffer from PCOS. Hold on just a second, guys. I'm doing laser here in Belgium, and I still have hair growing on my face. Is it normal? Not that much, but still. No, you're fine in English. Okay. So a lady on YouTube from Belgium that's talking said that she's doing since 21, that will be for 3 or 4 years, laser hair removal. What did I just say? Is it normal? So I will answer this question. Two things will happen why you require many laser hair removal treatments. We will talk now about laser for a minute and pay attention to me. There are two conditions. If you are suffering from PCOS or hormonal imbalance, then having doing laser for 3 years or 4 years or 5 years is normal. However, if that's not the case, and you are still having hair, then here is another condition that everybody should know. In America, there is not a law across the board that would go for everybody. Every state has their own laws. So since I have a clinic in Georgia, I can tell you, but I'm licensed in Florida, and I work in Florida and Miami Beach for 40 years. And ladies and gentlemen, my license is number 46. Today, licenses start with $500,000 and up. I am number 46. That must tell you how long I am doing what I am doing. So in Florida, this is important that you understand. Lasers have a place, and a laser is a laser, and there is an exact description of what a laser is and what a laser beam is. And in Florida, when you are licensed by the Board of Medicine and you perform laser and you sell somebody an IPL, and this is the crux that you have to know, you can lose your license. IPL is called intense pulse light. IPL is not laser. It's a box. It looks like a laser. It sounds like a laser. It emits a light. And anybody that is a layman that doesn't know the difference is being treated with IPLs, and IPLs don't work. IPLs will slow down the hair growth, but IPL will not get rid of your hair. It doesn't have the ability. Only true laser. So I do not know what your problem is. I do not know if you are treated with IPL. I do not know if you have a hormonal imbalance. So I give you the options. And I'm saying, my daughter will be in Miami this June, and I will send her to you. Okay, write down my telephone number. Guys, just write my telephone number and email, and I will continue talking. My number is 305-864-3333. 305-864-3333. This is my telephone number, so you can reach me on this telephone number. You can text me, and I can respond. I have an email. Can you share in your group? I don't know what my group is. I don't know yet how to work on crap. I apologize. But 305, I believe that my telephone number is on my homepage of my Eva Taub. That there is my telephone number, and there is my email address. But I give you. I'll just write it down. Med Spa. MED like medical, MEDSPA. So Med Spa 33154 at gmail.com. Med Spa, MEDSPA 33154 at gmail.com. At gmail.com is my email. You can email me there. If you know, if you have a story, and I will always answer. I will always read. But this is very important to understand the difference between IPLs and between true lasers. So why I said that in America, yes, thank you, perfect. MedSpace receiver. And can you write my telephone number? 305 864 3333. 305 864 3333. If somebody can write my telephone number, that would be great so other people can see it. Yes, bravo, thank you, I appreciate it. So I want to tell you this. Just listen to me. This is why education, guys, is so important. This is why I preach. This is why I talk. This is why I share my information, because maybe it will eventually, penetrate through people's ears, and eventually people will listen and will learn from me, and they will start pushing with their elbows and start learning and starting taking care of their own body. So in Florida, a laser is a laser, and IPL is an IPL. An IPL is a very cheap version of a laser, but it's not a laser beam. It's an intense sports light laser. And so they cannot destroy hair, but they're very cheap. So a lot of places will use IPLs. And if you don't know, you're just treated. And it's the same thing in Europe. You can be in business, you can be a medical doctor, doesn't mean that you have to be honest. Honesty is a rarity today. I am an honest person. I do this for over 40 years. I am not a multimillionaire. I'm probably not a multimillionaire because I'm honest. But you know what, guys? I sleep very well at night. I don't have wrinkles because I don't screw people up. I don't have to think, oh, I did this, I did it. I'm just I. I am the way I was raised, the way I believe to be is being honest, is being straightforward. So now let me tell you about the fact of what happens in the United States. So Belgium doesn't have to feel so bad. Don't feel so bad. If you were treated with IPRs and you still have hairs, if it's not a hormonal issue. So I opened my location in Georgia 8 years ago. Why did I open my location in Georgia? Not because I needed it, because you guys needed me to come to Georgia. Why did you guys need me to come to Georgia? Because so many over the years, women from Alabama, Mississippi, Tennessee, the Carolinas, Virginia, Chicago, Texas, New Orleans, Colorado, people would contact me and say, Miss Eva, do you have another location, or New York, New Jersey? Oh, I wish you were here, or I wish you were here, or I will. Okay, didn't happen. And then one day, over 8 years ago, I was sitting exactly here where I'm standing. I actually have 2 fauteuils here, and this is my waiting room. And I was sitting, and there is my office in that direction. And the telephone was ringing. In those days, it was not a cell phone. I mean, it was cell phone, but it was my telephone, regular telephone. And I went there and I picked up the telephone, and there was a woman that said that she's from Atlanta, and she said, "Oh, ma'am, I saw you on YouTube. Do you have a clinic by any chance in?" No, it's okay, I will answer you, Belgium. Hold on. Do you have a clinic in Georgia? And I said, no, I'm sorry, only in Miami Beach. She said, I can't afford it, I can't come. I'm sorry. I said, I'm sorry. And we hang up the conversation. Then there was like 1 o'clock. Then about 3 or 4 o'clock, I got another phone call, and there was a question, same thing, but this time it was a woman from Georgia. And she asked the same question. It wasn't Atlanta, it was Georgia. And I gave the same answer. I said, no, sorry, I only have a clinic in Bay Harbor. And by 7 p.m., there was a third phone call, which never happened to me before. I never got 3 telephone calls from black women from Georgia. And this was a black woman, again from Atlanta. It was the third phone call on the same day. It was 7 p.m. It was the same question. I gave the same answer. Then I came and I sat here and I looked up to the ceiling. I looked obviously to the sky. And I said, okay, ma'am, I got it. My mother is obviously dead. But I looked at her. I said, I got it. You're sending me a message. 3 phone calls. You must open a clinic in Georgia. Now, why Georgia? Because remember my story? Remember that I said that I have had, my daughter had 18 surgeries. And then after the first surgeries that were done in Miami, I flew to Georgia. And I was flying to Georgia close to, I don't know, 18 years to get surgeries for my daughter in Georgia. And so I already had a soft spot because the surgeon of my daughter was a very unique human being. I had a very soft spot for him as a human being, as a doctor, because it is very unusual in today's days to have a physician. He actually was born in Canada and he moved to Georgia. To have a physician that will pray, and he would pray. He asked me always before surgery, because I was always sitting with my daughter by her foot until they wheeled her in. And he would always ask, he would say, Eva, is it okay if I pray? And I said, of course. We have different religion. I'm Jewish and he was Christian. But God is God, makes no difference. And he would hold her hand, and he's a white man, and he would pray so hard, he would close his eyes, and his face would turn red because he prayed so hard to God. He prayed so hard. And he would ask God, he would ask loud, like, please, like, he asked God to give him the strength, to give him the ability in his hands to operate. Should this be the last operation of my daughter, should his hands through God be able to heal my daughter? And I think that is a very unusual approach. And he was a very unusual doctor, very unusual human being. And I had such a soft spot for what he was doing. Again, he couldn't change the outcome, but he relieved the pain that my daughter was constantly in. Even if it was for 5 months or 8 months, he would relieve her, and but he really didn't want to operate, but there was no other choice, because when you have endometriosis, you only have to exercise, cut and cut and cut and cut. So this is the issue. So I already had a soft spot, and so when I realized that my mother actually, because I'm not religious, I'm very spiritual, and there's a big difference, and I just felt that there was a connection, and that these 3 phone calls made me think that I need to do something. And so then for a year, I was thinking how to do this, how can I make it happen, because I'm very busy in Miami. I'm here for 40 years. I don't need to go, nor do I want to go, but I needed to go because it was a calling for me to help all the black women, to help all the unprivileged women that live in the deep south, that don't have a voice, that don't have anybody that can advise them, that the doctors that advise them are all bunch of idiots, are all people that graduated school, have $500,000, $1 million loans, and then they shove them and push them in all kinds of rural places, rural hospital, rural offices, and you get somebody who came out of school, and now they put him in there. What does he know? I always equate this to the same thing. You have a bad case, you have a criminal case, you go to the lawyer, you go to a law firm. Do you want the lawyer that graduated, he has a diploma, that he's a doctor? That he's a lawyer? Do you want him to represent you in a criminal case? Or do you want the 30-year-old or 40-year-old practicing attorney to represent you? It's the same thing. It's the same thing. You know, knowledge comes with years. Knowledge comes with experience, and so experience you cannot necessarily buy. And so when you graduate school and you have so many debts because you became a doctor, you will take job in any rural areas. And let me tell you something: that graduating students in the last 4 years in America, the graduated students, these students didn't graduate on merit. These students didn't graduate and became doctors because they are so smart. They graduated for different reasons. And so I can tell you categorically that majority of the doctors that are sent to these rural areas and they talk to black women or they talk to rural women that suffer from PCOS, they know shit from Shinola. They know nothing. They're exactly equivalent to a lawyer that just graduated school and has a diploma. It's the same thing. How much should they teach them in medical school about black skin or dark skin? Zero, zero, zero. There's no education. There is no curriculum in medical school that teaches you about black skin. None whatsoever. How much should they teach you in America in medical school about vitamins? Maybe in the last 8 years, they give you like 3 lectures about vitamins. How many doctors do you know that are really knowledgeable in vitamins? How many graduated that are knowledgeable? None. None. Because practice makes perfect. But you don't have practice when you go and you have to pay your bills, so you take any next best job. Ladies and gentlemen, I treat physicians that come to my clinic here and then come to my clinic in Georgia. Physicians. And my hair is standing up. My hair is standing up of the lack of intelligence, the lack of knowledge that these people have, the lack of elementary knowledge that they have. Elementary. Because I treat them because they have hair. Do you know how many physicians I treat, women that come to see me, that have unwanted hair and they know nothing about the composition of hair? I'm telling you, it's just that things go through my mind. I just don't want to share these stories just in case, and these people are listening on this now or later on. But it's just mind-boggling, how many people have zero graduated, have a diploma as a physician, and have zero understanding about the anatomy of hair, of human hair. I'm telling you. Whatever graduated in the last 4 or 5 years that went to school did not graduate on the merit and their knowledge and their experience. They graduated for different reasons. So you as a person have to be able to decipher and have to be able to understand who is knowledgeable and who is knowledgeable. Now, can you do it on your own? Yes, if you have the desire to learn like me, I want to know, I want to learn, I want to read, and I do this all the time. I want to educate myself constantly because you never stop learning. You have to learn as long as you live, to the day you die, you learn. So I want to educate myself and I want to know. But that's not the case with a lot of physicians or people in the medical industry. And so when you put a young man or woman that graduated and you stick them in some dilapidated hospitals, what happens? What happens? What do they know? They know nothing. And then they give this black woman, because the South, the Deep South, this is the majority of patients that I see. The Deep South is black women. There are white women, but because I specialize in black people and black skin for 40 plus years before I came to America, I see majority of black patients in Georgia. And these women come to me, and sometimes, guys, sometimes my heart bleeds. And I don't know if you believe this or not, but sometimes the stories that I hear from black women that come to see me, my heart bleeds. And look, when I opened Georgia, after these 3 phone calls, I decided I will make it happen. It was these 3 phone calls, and it was my mother that was make sure that I understood. I put everything in perspective. I like Atlanta. I like the doctor, so they were very pleasant to me and nice to me. and these are the women that need my help. And I have a daughter that is dark, and I have a daughter that suffered so much from this condition. So I know all this, so I have to share this. So I have to share this. Yes, I have to open a location in Georgia. And so I opened a second location in Georgia 8 years ago. And I only go to Georgia to help women. I go to Georgia every 5 weeks. I drive. I drive 1,200 miles from Miami, back and forth. I drive because since COVID, I don't fly. I drive to Georgia, and I do this every 5 weeks. Why? Because I made a commitment that I am going to be there as long as I have the energy, power, strength, and brains capacity. I'm going to go and I'm going to help black women, and I'm going to help women that are underprivileged, that live in rural America, that live in the deep South. And so this is what I'm doing it for me because it's my calling professionally. This is what I was put on earth to do, is to help women. And I don't believe that anything in life happens uh, by chance, as a fluke. I think everything in life is predetermined. And so this is my calling. This was predetermined. That I went through hell and back with my daughter, and my daughter went 100 times through hell and back for 30 years, suffering from PCOS, endometriosis, and 18 surgeries. That was probably something I had to go through. But because I went through all that, I have so much knowledge, so much empathy, so much understanding. That made me go and make the decision, in spite of logic, to go to Georgia, because I had to lay out the money to do this. And I am not there for 5 weeks. I go to Georgia, I stay in Georgia for 5, 6 days. I work and I come back to Miami because I have a very viable business here. And I have to be here. And the Miami crew of my clients is very angry at me that I disappear for a week. Because it takes me a day to drive back. So it's a week that I go away. People are pissed. Like, why are you leaving us for Georgia? Let Georgia come here. It's funny, but that's what it is. So I go to Georgia because I feel that I have a calling. I have a calling. And I want to share something else with you when we're talking about the calling. When I came to America, there was no licensing for electrolysis. There was no laser, but for sure electrolysis not. And because I remember my license is 46 in the United States. And because I came already, I was licensed overseas from the Board of Medicine. So in Tallahassee, they asked, would you like to join us? We are going to create a board. And would you like to join us and write a curriculum or we are going to license people to do electrolysis, which is the right thing. But I said, no, thank you, because I am not a corporate person. I don't answer to anybody. I'm independent and I do what I want to do. So I declined the offer. And I'm not a teacher. I don't want to teach. And so over the years, a lot of black people ask me, so on YouTube and Instagram and clients, and they say, oh, Eva, why don't you teach? I say, because I'm not my cup of tea. I don't teach. I don't want to teach. I'm not a teacher. I don't have the patience to teach. And so over the years, sort of it was in the back of my mind. And then I like very deep conversations with my daughter. And my daughter said, Mom, but by default you are teaching. I said, how is that? She said, well, when you go on YouTube, when you go on social media, and you talk exactly like I talk to you guys. She said, what do you think you are doing? You are teaching, you are educating people, you are giving information to people. And I thought about it. And I said, she's right. I do. So I created a course for anybody that wants to treat black skin. Anybody that wants to treat black skin. And I created a course, and it took me 1.5 years to put it together. To create a course that anybody, if you're a doctor, if you're a nurse practitioner, if you're a nurse, if you're a beautician, you're an esthetician, you're a cosmetologist, whoever you are, when you are licensed, you can buy my course. I created an online course. And I put my blood and sweat into that course because everything I know I acquired over 40 years is in that course. And so I created a course because I would like not to be the only one in America that knows how to treat black skin, but I would like to have like 500 women in America that would learn from me and would open clinics and would treat black skin. And what I'm going to tell you now is that there is over 50 million black people in America, and there is a big need to treat black skin. And you will not get this knowledge anywhere because I have on my own skin. I have the experience, I have the expertise on my own skin. So what I teach you, nobody will teach you. P.S. No curriculum on black skin in dermatology. No curriculum in medical school. No curriculum in beauty schools or aesthetic school about black skin. Non-existent. The only curriculum that you will get today in America that is worth millions of dollars is my curriculum, because my knowledge. I put everything that I know, I put into this course. And so all the course is online. I, again, don't know how to give it to you because I'm not that wise on social media, but I think on my homepage or something, there should be a link for the course. So anybody that would like to learn the course, or you know somebody who would have the love of helping other people, who would have the love of helping black people and dark-skinned people. Here's what I want to tell you. If you want to do this for money, move on. If money is your number one objective, move on. Don't buy my course. Don't want you to buy my course. It's not for you. Go buy somebody else's course and make money. It's not for you. I would love only people that have conviction, that have the desire, the passion to help people that need the help. This is the people that I would love for them to buy the course and learn and walk in my footsteps and then become my really disciples, and they just follow in my education, in my feet. This is, but not for money. Now, I'm not saying that you will be poor, but you will not become a multimillionaire. I promise you that will not happen. Because if you work with your heart and your soul and your brain and your hands, you can only do so much. And if you delegate to other people, it just depends. If every person, if you open a business and you hire 5 people and you have all 5 people learn from me and they really have the same passion that I have, then it's fine. But if you open a business, you bought my course, and then you think that you will teach what you learn from me to other 5 people that you hire, or just give them glimpses, don't buy my course. Don't do it. Because then you're hurting people. Because then your objective is money. Your objective is not helping people. My objective is helping people. My objective is to change the whole picture in America and to have enough people in America that will understand and treat black skin exactly the way I do, the way I treat it, that you will have empathy. Now, I understand that not everybody can have the same amount of empathy because nobody went through what I went through with my daughter. And so nobody will understand a woman with PCOS, a woman that has hormonal imbalances as hair, nobody will understand her. God, I understand that. Nobody will understand what I understand. Because the only way you really feel something if you feel it on your own skin. But when I give you the information, I give you the tools, I think it will prompt something in you if you really want to help people. So there is the course. Now, I want to read this. Okay, so this is Belgium. Okay, it's a real NDIAC, only for melanin skin. My dermatologist knows black skin. They never talk about diet, for example. Okay, so I'm talking to somebody, that question on YouTube, and the lady is from Belgium, and she says that she's doing laser hair removal already for 3 years, And yes, it is MDAC, and yes, she's black, and yes, her doctor knows how to treat black skin, which is fabulous because you're in Europe and they have much stricter rules and much better education for laser and for electrolysis than they have in America. So bravo, that's wonderful. Here is what I would look into. Two things can happen. So her problem is, and I don't know her whole story, but my assumption is she's black, she's getting in the arc, she's doing it over 3 years, on her face and she still has hair. So it can be hormonal. You might have hormonal imbalance. I do not know that. You do blood work. If you have PCOS, endometriosis, diabetes, Hashimoto disease, check all your hormones. And if everything comes back normal, well, guys, pay attention to what I'm going to say because this is a bombshell that I'm going to put down for everybody out there. For everybody out there. Your blood work is perfect. Your hormones look normal, but you're still hairy. And you have to repeat treatments. There is a disease, or it's not a disease, it's a condition. And that condition is related to hormones. And that condition is related to a specific hormone. And we call this, pay attention, take a pen and paper. Take a pen and paper, write down what I'm saying now. Okay, you have fibroids, you have PCOS. So there I start with this. Fibroids are polycystic ovarian syndrome. That's what you have. So if PCOS, so we already solved the problem. There is the problem. And because you have PCOS, because you have fibroids, which is the same thing, you have hormonal imbalance. And you have hormonal imbalance, and the hormonal and the hormones that float into you through your blood vessels, they are stimulating the hair follicles. You have 1,000 hair follicles on a square inch of skin. If you have hormonal imbalance, you might have 2, 3, 4, 500 hair follicles that are active. And they constantly will be active and active and active. This is why I said that if there is a hormonal imbalance, you require 30, 40 treatments with laser, not 12. Okay. But now I'm going to say something else. I said that there's a bombshell that I'm going to give you that nobody tells you. Nobody tells you. Your hormones are perfect. You don't have cysts. You don't have anything. You're perfect. Your hair's picture of perfect hairs, but you are hairy from here to your toes. There is a condition, a hormonal condition, and it's called, pay attention and write it down, free floating testosterone. Pay attention to what I'm saying. I'm going to explain this. Free floating testosterone. So we all have progesterone, estrogen, testosterone in our bloodstream, right? Free floating testosterone in women only happens 2 days or 3 days before you get your period, when you ovulate. When you have, and some women will have perfect blood work, but they have free floating testosterone that is elevated only for 2-3 days out of the month. 2-3 days out of the month. That's it. Nothing more. 2-3 days out of the month. It's elevated. And what that means is that for 2-3 days out of the month, that free-floating testosterone will go 2,000 times higher than your regular testosterone. But because when you do blood work, they are checking only your regular testosterone that everybody has. They are not looking for free-floating testosterone. And when free-floating testosterone pushes 2,000 times more testosterone into your bloodstream for only 2 or 3 days out of the month, it is sufficient in your bloodstream, to be in your bloodstream, to feed you hair follicles, to germinate new hair follicles in your square inch of skin where you have 1,000 hair follicles. But it will not be detected in your regular blood work of hormones that you do at the doctor's office. It won't be detected because they're not looking for free-floating testosterone, but it is in existence. And so when you go to, this is why I said, write it down, because this is very important. You go to your doctor and you did blood work, and says, no, your blood work is okay, there's nothing unusual. Now you tell him, okay, I want you to do a free-floating testosterone. And if he says, I don't know what it is, say to him, go on the internet and study it. And he give me a prescription to do blood work for free-floating testosterone. It is usually, you have to calculate, it is usually 2 days, 3 days before you ovulate. You go and you take blood work. And for those, in those days, the 2 days, 3 days before you ovulate, when they take blood, if you have elevated free-floating testosterone, bingo! You can be perfect, but this 2,000 times more free-floating testosterone in your system and in your bloodstream is the cause that you are very, very hairy. But you don't have PCOS, you don't have diabetes, you don't have thyroid condition, you don't have anything, because all your blood work is perfect. Guys, I think I shared with you a lot of information for today. So now I think I'm going to go. I'm going to say thank you very, very much for everybody that listened. If you have any question, yeah, free floating testosterone, exactly, Oria. Free floating testosterone, that's exactly the name that I want you to look for. Free floating testosterone. And you ask your doctor. Some doctors will know what it is, a lot of doctors will not. But this is what you are looking for, this is what you're asking for. And if you don't have, if your other hormones come back perfect, but you're still hairy, very hairy, and your laser doesn't work. So it's free floating testosterone. Ladies and gentlemen, I'm in Miami Beach, I'm in Atlanta. If you fall into the category of people that listen today, if it's you, if it's your family, if it's your friends, anybody that listen today or anybody that will listen in the future, I don't know if this stays on Club. I know this video stays on YouTube, but I don't know if it stays on Club. No idea, because I don't know the system yet. Share this information. Share this information with people. I think, Diane, thank you. I think that it is super important, because what I tell you is so valuable that it is worthwhile to share with other people, because I promise you that 99.9% all of you today that watched here and watched here never knew about free-floating testosterone. So I shared with you stories, but they are all factual. And I share them because I want to make your life better. I want you to make your life better. I want you to walk in with confidence. I want you to know, as a woman that suffers from PCOS, as a black woman, that there is an answer, that there is a solution. For right now, it's me. For right now, you have to make it to Florida, to South Florida, or to Georgia. There's no other place. Maybe in the future there will be others. But right now, not from me. I can only do so much, guys. But maybe there will be others that will learn, and then they will open clinics. Fine. But right now, you have me in Georgia, you have me in Miami. You can make it. You can make it if you want to. Listen to me. I have people, again, I said there's people that fly. I have people that come to see me from Colorado, from Denver. They come either to Miami Beach or they come to Atlanta. I have people that, the Midwest, so I think the mid of America and the East Coast comes to see me. Where there is a will, there is a way. Listen, I used to fly to a dentist, a specialist that was doing work for me, and I used to fly to Pittsburgh for maybe a year, because he was doing work. I liked him. I liked what he was doing. He was a specialist, and I went to see him there. So listen, today flying is not what used to be once upon a time. You can fly. You can find cheap flights. You know how many people come to see me in Atlanta that fly from Texas, New Orleans, New York, New Jersey, Chicago. I'm just thinking where everybody comes from. Arizona, people fly to see me, and then there's a lot of people that come and drive to see me in Georgia. So if you're like in Virginia, from Virginia down, you drive to see me. If you're in North Carolina, South Florida, Tallahassee, you come to see me in Georgia because it's shorter, And if you are, if you live farther up to mid-America or up in America, you fly to Atlanta. It's cheaper and shorter because Atlanta is higher than Florida. Florida is down, so it's longer flying and more expensive. So Atlanta, that's why I did it. So I make it possible. And then everybody else, where you are Mississippi, Alabama, Tennessee, or North South Carolina, you're all, or Virginia, you're driving to see me. So if I can drive 12 hours for you, you can drive 6, 7 hours for yourself because I am there for you and I make it possible. And when you drive, you drive. So you take a day off. And when I'm in Georgia, I do work Saturday and Sunday. I don't work Sunday in Miami. But I do work Saturday, Sunday because I'm only there for limited time. And I work from morning to evening. I see one patient after the other one. Okay, I was quiet for a minute because I was reading, and this young lady from Belgium is saying, okay, oh thank you, Eva. I will send an email. Is saying that it's really annoying because all my doctors always said that I don't have PCOS, but I had all the symptoms. So ask them what are fibroids, if it's not PCOS. What is a fibroid? But you know what? Don't ask them. Go on the internet and just look. Uh, for what are fibroids, what are cysts? What's the difference? You will see. It's the same thing. Same thing. So what they say, so again, it's women have to take care of themselves. Women have to take care of their own health. We have to be our fighters. We have to be the ones who fight for ourselves. And we have to have elbows, and we have to demand better care and proper care, and educate yourself, read, go on the internet. A very good tool is ChatGPT. Go to ChatGPT, research, ask questions in many possible ways. ChatGPT can give you a lot of answers, a lot of good answers. Ask, and you will find out. Because you will, it's sort of, it gets a lot of information. It gives you generally good information. You, of course, have to decipher if it's ridiculous, but most of the time it's not, and you get a lot of information. Actually, you get more information from ChatGPT than you get from search engine from Google. So research. But I gave you the tools, I gave you the information to all of you, ladies and gentlemen. So I wish you an amazing, amazing weekend. I do ask, if I don't know how this works on Clapper, guys. I have no idea. I was introduced to Clapper. I listened to somebody and he said, "Oh, go on Clapper because that's good." And I like the audience on Clapper much better than I like the audience on TikTok. It's just, I think it's two different people, and I am not fancy. I don't put a fancy makeup. I don't dance stupid dances here. I talk facts. And I think that Clapper has sort of the same audience like on YouTube. It's just on YouTube, I am for 14 years. I'm established, YouTube people know me. So it's sort of home base, but Clapper is new to me. And I do not know how this works. I think this video stays, like on YouTube, this video stays on Clapper. And I don't know if you can share it. I have no idea. I only know to open the Clapper application and then go live or upload the video. That's all I know. So I do not know. So please help me out. If this stays great, if you can share it with other people, please kindly do, because you know that what I said today you have never heard before. And what I said today is valuable information. So please share it, guys. On YouTube, everybody knows I've asked to do this. Share it. I thank you very, very much. I wish everybody a peaceful, amazing weekend. Please stay safe. Thank you very much for listening to me. And I wish only the best for all of you. Thank you, thank you, thank you. Ciao. If I missed something, no. Okay. Ciao. Ciao, bambina. Ciao. Auf Wiedersehen.